Welcome back, listeners, to RxPerts podcast. I am Carol Matichka, your host, bringing you interesting guests who share their perspectives and expertise regarding topics surrounding the profession of pharmacy. I'm very excited to be back for this new season of RxPerts and really interested to hear from all of you, our listeners. So if you have a topic or guest you'd like to hear about or from, just drop me a line. I'll try to incorporate them if I can into our lineup. So I wanted to start the year off with a guest who's done quite a bit since graduating from the University of Florida. So please welcome Shivani Mehta. Welcome, Shivani.
Thank you. Thank you for having me.
Of course. So Dr. Mehta is a community pharmacist who's the director of Baya Clinical Services at Baya Pharmacy. It's an independent pharmacy located in Lake City, Florida. And we often talk about the future of pharmacy on this podcast, particularly community pharmacy. And really, I feel like Baya is at the forefront of many of the efforts that we talk about in regards to clinical care. So I'm excited to hear from you today.
Thank you.
So, Shivani, tell us a little bit about yourself. What first interested you in the profession of pharmacy?
Sure. So my name is Shivani, and I graduated from University of Florida College of Pharmacy, class of 2022. From a young age, I was deeply interested in the healthcare field, driven by a desire to make a meaningful impact on people's lives. Watching my father work as a pharmacist inspired me to follow his footsteps. His dedication to his patients and the pivotal role that he played in the healthcare journey as a whole left a very lasting impression on me.
Oh, that's awesome. My dad's a pharmacist too.
Oh, wow. So that's originally where it inspired. But then also pharmacy combined my love for science and patient care both together. So it felt like a very natural path. And over the years, my experiences both in school and out of school have strengthened my commitment to the profession and have particularly been motivated by the opportunity to serve my community.
Fantastic. So you are an independent pharmacy. What drew you to independent pharmacy and really led you then now to this directorship at Baya?
Sure. So my interest in pharmacy, like I mentioned, started with my father, who actually works at another independent pharmacy.
Oh, great.
So again, following his footsteps right there directly. And honestly, it was the concept of independent that drew me into pharmacy as well. The ability to offer personalized care, focus more on the community with opportunities to promote things such as like health equity and enjoy the high level of autonomy with entrepreneurial opportunities also greatly appealed to me. So I started with Baya back in 2020. A professor at the college recommended that I start volunteering there because they were actually looking for some interns to come help with COVID tests. So I started as a volunteer back in 2020, every weekend doing about COVID-19 tests, and I would do about 70 of them in 4 hours. So I'd say it was pretty busy.
What's specific?
That experience then led me to do one of my APPI, so the advanced pharmacy practice rotations there at Baya Pharmacy, and that then ultimately resulted in my employment as pharmacist and then directorship as well.
Wow. Well, you obviously loved it, and here you are, still there.
Yeah, so we currently have 5 pharmacists. I don't know if it's coincidentally or this means something, but all of us somehow started either as a volunteer or as an intern or did a residency, which has then led to us working there. So all 5 of us have followed that same path.
Wow, that's amazing. And we have a lot of students who are listening, and you being a recent grad, I think this is fantastic that you're on. So what advice can you give to them when they're considering their pathway? So was this the pathway that you already had chosen, or was it something that, you know, came about and you really loved it and that's where you're at?
Sure. So independent has always been in my mind, but Baya was not something I had even thought about until, honestly, not even until when I was there. Even when I was there, I had no idea that this is where I was going to end up.
Sure.
So My recommendation for students is to explore opportunities right away from their first year in pharmacy school, whether that's getting involved with local independent pharmacies, doing rotations at independent pharmacies, or attending job health fairs that I know most universities put up. Each experience is valuable, whether that's with a potential employer or somebody, a pharmacist that you've never met. Each encounter has always, in my head, been like a job interview. You don't know what you don't know at that point. I also know that the University of Florida College of Pharmacy hosts the Rx Ownership Summit. They recently started doing that, and I was a speaker out their first one, and it's an excellent, excellent event. We had amazing speakers with great variety of experience that they were able to bring to the table. And personally, the best way to learn is by listening to those in the field, understanding their successes, but also their challenges that they've overcome, because not every day is always a good day.
Sure.
And I guess the idea of showing up, whether that's to a conference, statewide, nationwide, campus events, or independent pharmacies, just to show up to understand what they're doing, that can open a lot of new doors to new connections, contribute to your growth as an upcoming healthcare professional. And one of the last things I'll say, I guess, is like you mentioned, I'm a recent graduate. I love mentoring students. I think it goes really, really long way. So I'm always available as a personal resource to help and motivate in any way I can.
No, that's great. Another thing I always say too is don't close any doors. Keep doors open. You never know. You might think, I will never do this. And then you end up going and working for somebody that you said, I will never work there or something.
Exactly. I mean, I
close doors.
I didn't know Lake City until I came to Lake City for the first time. I had no idea.
You never know. So tell us about the clinical services that are offered at Baya, because you guys are really innovative.
Thank you. So just to list some, I started up test and treat, chronic disease management, including obesity management, both sterile and non-sterile compounding. We recently got into doing some colorectal screening at the pharmacy, and of course the health equity program. And then we also do some long-term care at home, and then vaccinations and MTM as well. So a little bit of a lot of things.
Wide variety, sure. And I personally have a keen interest in the management of obesity. I do teach the module with our students. It's certainly a significant issue or interest of mine. So tell me what that program looks like specifically.
Absolutely. So my obesity management program is designed with a comprehensive approach to chronic disease management as well. I emphasize this because addressing obesity as a root cause of many chronic illnesses is a pretty important component to understand. By targeting the underlying issue, we not only manage those existing conditions, but we can also help prevent the onset of many of those, whether that's cardiovascular, respiratory, mental, or anything beyond that. Recent medications like semaglutide, also known as Wegovy, or tirzepatide, also known as Zepbound, have become popular for weight loss. So those are some of the medications that we promote at the pharmacy. However, it is extremely, extremely crucial to understand that lifestyle management is equally, if not more important, when anybody is on these medications. Therefore, proper nutrition and exercise counseling goes right hand in hand. So specifically to my program, so in collaboration with mid-level practitioners, we serve about 1,000 patients in our community.
Wow.
We initiate treatment with the medications as needed, follow up patients on a monthly basis with counseling sessions, and also progress check to monitor both obesity and any other medical conditions, and then have them follow up with their primary care as needed from there. Most recently, I designed and oversaw the production of a sterile compounding clean room within our independent pharmacy, ensuring compliance with both USP 797 and the Florida state regulations. And one of the aspects of that was to address some of the shortages that we face with the medications as well.
Yeah, so significantly.
Exactly. So all of that in combined makes our obesity program.
That's fantastic. I mean, I can only imagine the success that you see with some of that. You know, it's really been a game changer. The GLP-1s that have come out really have helped patients significantly. Biggest challenge, though, of course, insurance. Are you finding that that's still a big challenge for you in trying to get coverage, which blows my mind since so many patients can have such significant benefit from all of their other disease states. So, um,
100%.
yeah,
I've had many upset patients because they either were able to get started on it because their insurance covered it in the beginning, or they received a sample from their doctor who recommended that to them, and then realized that their insurance wasn't covering it. So that is one of the biggest drawbacks when you know the medication is doing such wonders. I've had so many success stories from many of my patients and their doctors of how much this has done. The the upside on that is being able to get the compounded medication for that from approved compounding pharmacies, whether that's 503A or 503B. So that is where we're currently contracted with one of the compounding pharmacies, and we're able to supply our patients with the compounded medications. And that, on the other hand, does not go through their insurance. So that is a cash-based model that we have. I will say, although it may not be the most affordable thing, it will, in the grand scheme of things, compared to the brand name, it still is a very reasonable price when somebody looks at them.
yeah, that's what I was going to ask as well. Now, I will say a lot of people get concerned about then the rebound afterwards if they stop the medication. So that's great that you're doing all the nutrition planning with them, giving them exercise plan and all of that.
Exactly. And understanding that it's not a one plan that fits all. Everyone's body's built differently. Everyone's work life, home life is so different. So trying to fit a one plan that fits all becomes almost nearly impossible to do. So understanding their background and trying to set small and realistic goals goes a long way.
Sure, absolutely. Well, that's great. So tell me more about some of the other disease states that you help manage.
Sure. So we counsel patients on diabetes, hypertension, and hyperlipidemia. With that, we include point of care testing, such as A1C, lipid panel, blood pressures, or just counseling on how to take their medications or use their instruments, such as their meters and insulin pens and things like that. If they do end up doing one of the point of care testing with us, we then provide an official report from our end that we then tell them to take back to their primary care, depending on what it is, with the appropriate recommendations that we have. And having that accessibility for patients also goes a long way. A lot of our patients struggle with getting into their primary care doctor's office at a reasonable time still. So I've had patients come in with just, hey, my heart's palpitating. Can you just check my blood pressure? Check their blood pressure. Their blood pressure is fine, or it's low. And I'm like, okay, let's get you checked by somebody else real quick. This is what's happening. Or I've had somebody come in, I'm a little dizzy. Think it's blood pressure. I check their blood pressure. It's fine. I check their sugar and they're hypoglycemic. So it's just that accessibility that we're there. It took a while for patients to change their mindset from going to their emergency room to the urgent care. It's a very similar mindset where you don't have to go to the urgent care. You can go to a pharmacy and just ask for these things. But that's where we need to educate that we can do these things for you, and we're here. We're more accessible for you guys.
The cost savings is tremendous to the healthcare system. Like I can't even imagine what you're saving by having patients come in. And it really is the future of pharmacy. I truly believe that. So kudos to you guys for all of those efforts. I think that's fantastic.
Thank you.
So, and you talked a little bit about test and treat. So that's really an area where pharmacists can make a huge impact. I mean, we talk about shortages of primary care physicians. It's extreme right now. It's very difficult to get into your primary care. So you having that impact on the community, talk to us a little bit about that. I know flu season is right around the corner. And so patients can need to understand that there is this potential option to be able to go to the pharmacy and have test and treat services.
Sure.
So talk a little bit about that.
So test and treat was actually the first service I developed at Baya Pharmacy. And that is in collaboration with a medical director that we have.
Okay.
So as a profession, we actively advocated for the ability to vaccinate our patients in the pharmacy to increase accessibility. Now that flu season is approaching, we can not only vaccinate, but also test them for flu. So our first protocol that we had developed was for flu A and B testing, allowing us to both diagnose and prescribe the appropriate treatment if they're positive, but also the appropriate treatment, the appropriate symptomatic treatment if they're negative. So we currently have approximately 15 protocols for minor uncomplicated conditions, including strep A, COVID-19, urinary tract infections. So the patients come in, they get tested and receive treatment. It's the idea of like a one-stop shop.
Yeah, that's fantastic. Does insurance cover any of that?
So yes and no. It depends on their insurance,
Right.
but we have been able to bill insurances for the test that we have provided, and we have seen coverage from it. So yes, and then yes for their medications. Even if they don't have insurance or out of pocket for the test and treatment, you'll roughly land around $70, $80
Oh, wow.
for the whole visit. And when you think about it, to just get into an urgent care without an insurance, you're looking at about 100 to 150,
Sure.
depending on where you're going, plus another couple hours of a wait.
Right.
But, then you have to go find a pharmacy to get those medications from. So the accessibility, the feasibility, both financially and the idea of a one-stop shop right there.
Is that a walk-in option or do they make appointments?
We have done walk-ins.
Oh, wow. Okay.
So we're very fortunate because we have at about 3 pharmacists at both locations. So we always have one pharmacist who's able to do a test and treat right away. And our turnaround time is about 30 minutes. The test will take about 15 minutes plus 15 minutes of counseling.
Wow, that's great. And I often hear pharmacists who are concerned about the time that it takes for things such as test and treat. So what are your thoughts about that?
Sure. Offering testing and treatment in a local pharmacy has enhanced our healthcare system by affordability and immediate care for many of these conditions. It's reduced emergency room visits, lowered cost for insurance providers as well in general. I agree. Consultations can take time. I mean, if you think about it, I just said 30 minutes of my time. That 30 minutes, typically, as an independent pharmacist, the role would be I'm behind the counter checking scripts. But having that, so when I started, I was the sole clinical pharmacist there, which this is what I focused on, to get out of behind the counter and open and broaden our mindset of what else can we do. There's so much that we've been taught in school. How do you apply that in an independent pharmacy? And how do you make it feasible financially? Everything sounds great theoretically, but practically, how are we going to make it work?
Right.
But those consultations, taking that time out, that's where we advocate our value of our profession as a whole. We talked about patients struggling to get into their primary care same day, next day appointments. This takes care of that. And we're a valuable resource in situations like this. We're fostering care for the patient while collaborating with all of their healthcare providers. And I mean, again, it's the one-stop shop. It allows for a comprehensive, holistic approach in treatment. When you go to a physician's office, you typically don't say, hey, I'm here for just this and only look at this. Don't look at anything else. You go in and you get checked out for your whole medical history. So that's the same idea. They come in to get treated or tested and treated, but you also look at what medications are they on? Are there any drug interactions? Where can we do a med rec with them? Tell them about vaccinations in the future. There's so many gaps that we can close just with one visit, but it's educating patients that this is what we can do. And word of mouth I'll speak in an independent and rural town goes a really long way.
Absolutely. That you said it so well. I mean, we really need to start doing these things because the old days of being behind the counter and just counting pills and I'm not saying that that's what everybody does, but certainly that's what I think a lot of people think when they think of pharmacy. And we're so much more, and doing that and really showcasing what we're doing, I think is absolutely huge and necessary for our profession to move forward. So great job there. Great job.
I think there's tremendous opportunity on what we can do. And it's, again, teaching the students and them knowing that, hey, this is there. You don't have to be behind the counter, although there is absolutely nothing wrong with doing that. I
No,
appreciate
and that's
that.
part of our job that we
Exactly.
certainly need to do, but there's so much more that we can do as well. And I think that's the most important piece of all of this. So I do know you were very involved as a student in various organizations. So how did you manage that and then moved on past graduation and continue to be involved in the profession, which is super important?
Sure. I, I, it was hard for me to get out there. I was a very shy person. So putting myself out there with many local and state national organizations was as important as difficult as well. But currently I'm actively involved in local, state, and national organizations. I serve as the chairwoman of the Professional Affairs Council for the Florida Board of Pharmacy Association, and the lead advisor for the CPSN Community Pharmacy Enhanced Services Network Next Generation Pharmacy Program. Well, I'm also actively involved in APHA, and locally, I am in the healthcare leads team for our Chamber of Commerce in Lake City. So I have my foot in a lot of different things, but it gives me a chance to not only make an impact in my community, teaching my patients, the local employers that we have, but also advocate for our profession, both at the state and a national level.
Which is also so important. And I think one of the big advocacy efforts is making sure that pharmacists can actually do what they've been taught to do. So I don't want to downplay some of the challenges that pharmacists face, especially in some of our chain pharmacies. I mean, it's real, and the struggle and the time is very real. I'm just really hoping that we can get to the point where they're able to do more of this patient care that you do. And I think AI will play a big role in that. I think we've seen various systems in which we can alleviate some of that stress for having to manage some of that. So you being a recent grad at the very beginning of the AI explosion, do you have any thoughts about how AI and this technology will really shape pharmacy?
Oh, I mean, I think it's just the beginning. I
Mhm.
think there is AI is set to revolutionize the future of pharmacy. I mean, whether that's by enhancing patient care, streamlining our day-to-day operations, or improving medication management in general. Um, Personalized medicine through tailored therapies, or even predicting health issues from an early intervention through pharmacogenomics. I think that is absolutely amazing. What we currently have is automated dispensing. That increases our efficiency and accuracy in general. Um, I think AI does and will continue to play a huge role in drug discovery, monitoring real world drug efficacy, and improving medication adherence. There are so many instruments even out today where blood pressure or glucose can be monitored remotely by a pharmacist or a provider if a patient has the right equipment. It also supports clinical decision making, evidence-based recommendation, enhances telepharmacy. I think starting beginning of COVID, that was a huge change in our um, mindset from having in-person conversations to going to telemed. I think that's just as important, it increases remote access for patients who cannot physically make it to the pharmacy and aids in continuing to provide that those services that the patient needs.
Yeah, I agree. And you being in a rural community, I can see AI also helping catch perhaps some patterns that is being seen in your community to really help try to curb perhaps some sort of epidemic, maybe that is occurring, that sort of thing. So, so many uses. It could
Yes.
go on and on. And I foresee us in 5 years talking about even bigger and broader things. It'll be quite impressive, I think, as we move forward.
Yes, yes.
So to finish up, let's have a fun question for you. If you had one word to describe pharmacy for you personally, what would it be?
That's a difficult one to answer.
It is tough.
Pharmacy is a lot of things for me. That's everything that I wanted to be since I knew healthcare was a thing. Um, but from the day I started understanding pharmacy to all of my experiences and my knowledge today, I think transformative would be my word.
Oh, I like that.
It has the power to significantly alter patients' lives through medication management, personalized care, and preventative services. It's a field where you can see tangible changes occurring right in front of your eyes and contribute to their overall well being, making a long lasting effect on their health. And as a profession as a whole, it's transforming as we speak by us pharmacists and these upcoming graduates that we're going to be having soon.
I love it. Well, Shivani, it's really been a pleasure having you on our podcast. You've been amazing. Thank you for all of your time and for all that you've done in such a short period of time and really helping transform your pharmacy and helping create what we're looking for in our profession, really being able to care for our community to a greater degree. So thank you so much.
Thank you for having me, and I appreciate those kind words.
Of course. So, listeners, don't forget to subscribe to our channel and feel free to send any feedback that you have. Take care.